My name is Farron Hurwitz. I work for an organization called Health Choice Network. We are a health center controlled network out of Miami, Florida. I've been a Dentrix Enterprise customer now going on 18 years. Our organization is a health center controlled network. We are a 501c3 organization based out of Miami, Florida. We have been using Dentrix Enterprise now going on 18 years. We currently have 22 federally qualified health centers utilizing Dentrix Enterprise. When I first came on board, we were looking for an electronic oral health record. I was tasked in finding the best in class, and 18 years later, we're still with Dentrix Enterprise. Over the years, Dentrix Enterprise has grown with our health centers. We feel that when we were looking for an electronic oral health record, we were looking for three things. We were looking for best in class. We were looking for a system that will help our providers with efficiency. And most importantly, we were looking for a system that will help keep our clinical quality measures, capturing our clinical quality measures, reporting our clinical quality measures, and give us tools to grow our practice. I think what we found most useful, obviously when I mentioned the best in class, we believe that Dentrix by far is the best when it comes to the clinical documentation. There is no better. There is no better patient charting. There is no better perio charting. There is no better treatment planning than Dentrix Enterprise. The piece that we found the most useful, though, is that integration with our medical software so that we could have one source of truth, one database for data entry and registration, and then as our users register our patients inside of our medical record, that information flows right into our dental electronic health record, Dentrix Enterprise. Enterprise has grown greatly. We've been using Dentrix Enterprise since 1.0. When we first came on board, we had limited integration with our electronic health record. I am proud to say, after 17 years, we currently have some pretty tight integration with our electronic health record. We currently have our demographics flowing between our electronic medical record and our oral health record. We have charges flowing back and forth between our electronic health record and oral health record, and we also have scheduling flowing back and forth. I will not rest on my laurels until we have full integration, and when I speak about full integration, I'm referring to allergies, medical alerts, problem lists. That is my goal for this year, is to build tighter integration between our electronic health record and oral health record. I think the biggest value is one, the cost. I mean, to have the best in class system at the price point that we as community health centers have with our special markets has been absolutely a blessing, because for the first time it's not a barrier. Cost does not become a barrier to growth. And a lot of our health centers are growing. They continue to grow in the oral health sector. I think finally, after 17 years, I think all experts understand and believe that oral health is a critical part to the overall health care of our patients. No more is oral health the secondary or redheaded stepchild, if you will, in the conversations. Oral health becomes the first and foremost part of all discussions when it comes to overall health care. I think just the treatment plan presentation has been instrumental in our organization. I think, in this day and age, regardless if you're a community health center, private practice, small group, large group, I think giving patients options in a patient-friendly way is what makes Dentrix so valuable. We're able to sit at the point of care and present multiple case options to our patients and really make them a part of their own overall oral health care. And I think that has been really the piece that separated Dentrix Enterprise over the years. Our patients love it. The parents love it. When we talk about children and pediatrics, we talk about the caries risk assessment and the caries prevalence, and we're really able to engage the parent from an education standpoint on how to put the child to sleep without having a bottle inside their mouth filled with Kool-Aid, for example, or apple juice. So it's really just the education, it's the presentation, and it's the overall delivery of oral health care is really what separates Dentrix Enterprise.